Hello, my name is Cristel Castro Barahona, and I'm going to talk about the role and impact of cooperative extension in diabetes education in self-care. Definition: diabetes self-management education is recognized as a key component of effective diabetes care. DSME is a collaborative process through which people with risk for diabetes gain the knowledge and skills needed to modify behavior and successfully self-manage the disease and its related conditions. This process incorporates the needs, goals, and life experience of the person with diabetes.
Have you or a family member been diagnosed with diabetes? Do you feel overwhelmed by the information you've received about how to manage your diabetes? Good news! There is a valuable resource available to help you take care of your diabetes. Diabetes Self-Management Education is a program where you will get customized one-on-one training from a diabetes educator. A diabetes educator is a specially trained individual who understands what you are going through and can help you make a plan and put the skills you learn into practice. You also get group support from others who have diabetes. This program will help you learn the skills needed to manage your diabetes and thrive in your life. And as an added bonus, Diabetes Self-Management Education is covered by most insurances. Ask your doctor for a referral to Diabetes Self-Management Education today, or visit livingwell.utah.gov to find a Diabetes Self-Management Education program near you.
Application in nutrition. Daily care is managed by you. The plan includes choosing what, how much, and when to eat, keeping a healthy weight, making sure you include physical activity in your day, taking medications to help achieve your goals for blood glucose, blood pressure, and cholesterol.
Nutrition has a huge impact on blood sugar management. Whether you have type 1, type 2, or gestational diabetes, your food choices make a huge difference. Today I will provide you with a few real-life tips that you can integrate related to nutrition and exercise to help with blood sugar management. First off, please stop drinking your carbohydrates. That regular soda, that sugary coffee drink can have 45 to 60 grams of carbohydrate. That's about as much as someone should consume in a meal, and you're having it just in a drink. Something else you can do to really help blood sugar management is to eat consistently. Do you find yourself frequently skipping meals or in the office break room holding yesterday's donut? If so, maybe you should plan ahead for success. Try packing a lunch the night before or even buying a pre-made salad at the grocery store for an easy on-the-go option. The next tip for balancing blood sugars would be to try to find some balance in your eating plan. Instead of viewing foods as good foods or bad foods, try to find balance in protein, carbohydrates, and fats. If we tend to think of foods as bad foods, we might overindulge on them when we feel like we're restricting. So instead, if you're craving a donut, have one donut, but maybe you pair it with an egg or go for a walk after breakfast. What about you're at a pizza party and you really want that slice of pizza? Maybe you order an entree salad to eat first and then enjoy 1 or 2 pieces of pizza. But make sure you eat slow, eat mindfully, and most importantly, enjoy the company of those you're with. And finally, the last tip would be move your body. How often have we heard a physician say, just work on exercise, but what does that actually mean? Why not try something new? Yoga, Pilates, Tai Chi, kickboxing, whatever it might be, just get out and move. If you feel like you're struggling, try to recruit support. Look to friends, family, or even neighbors to walk together, try a new DVD, or even go to the park. Diabetes and blood sugars is a very complex issue, but try incorporating some of these easy tips into your everyday life and see if you can find some good results. I challenge you today, after dinner, go for a 15-minute walk. Check your blood sugar 2 hours later, and that might be the encouragement you need to get your body moving.
Pros: it has been shown that individuals with developing diabetes can have an impact on the progression and development of their disease through intensive self-management activities. The International Diabetes Federation recognized DSME as a critical, important, fundamental, and an integral component of diabetes prevention and care and should be available and accessible to everyone. Cons: One of the main patient barriers was not being aware of its need. Another common barrier is the cost or lack of insurance coverage, which makes it difficult to diagnose the disease on time. Applied in Ecuador. According to the INEC, in 2019, diabetes mellitus was the second cause of death in the country. For that reason, the MSP made a practical guide called Diabetes Mellitus, in which they teach you count carbs. Carbs include bread, rice, cereal, and fruit. These can all raise your blood glucose levels, but keeping the amount of carbs in your meal consistent daily will help reach target glucose levels. The guide also recommends you can still enjoy the food you like, but in moderation. It is important to include more high-fiber foods such as fruits, vegetables, dried beans, oatmeal, and whole grain breads and cereals. Conclusion: diabetes education programs collaborate with the dietitian educators to develop a full lesson using the plate format to teach individuals about the type and amount of foods they should consume at each meal. The management of diabetes self-care is largely the responsibility of the patient and their interest making dietary and lifestyle changes. Several factors have been associated with an increased risk of developing type 2 diabetes, such as a family history of diabetes, being overweight, having an unhealthy diet, physical activity, increased pressure. Thank you.